always a pleasure to be here with you. Hello, everyone. Welcome to the African Podcast TV. This podcast is about Africa, regarding the political side, the historical side, the cultural side, and so many more. Each week, I deliver my best thought and analysis regarding Africa. Here, your host, Amaduba. Join me to welcome my guest, please. My first guest is Patricia Monthé. She's the founder and CEO of Medex Care and member of the advisor board Deun Women Entrepreneurship Network. Thank you so much for joining me this weekend on African Podcast TV.
Pleasure
And
is
my
mine.
second and my second guest is Princess Murajan Oglana. She's the founder and CEO of the African Women's Health Project International and president and CEO of Innovative Global Consultant Group. Thank you so much for joining me this weekend on African Podcast TV.
It's a pleasure to be here with you.
Thank you. We are here to talk about the healthcare system in Africa, especially regarding women and children. We know how that is really difficult for African continent. Healthcare system is really poor in some countries. So first of all, Princess Murajin, how do you see healthcare system in Africa?
Well, the healthcare system in Africa is still a lot behind the West. I came to the United States in the mid 80s, and when I came over here, I saw definitely the stark difference between here and there in on the continent. Because what I believe that in Africa, what we really need to really concentrate on, especially post this COVID-19 that's really rampaging all our lives all over the world, is to
Mhm,
build more infrastructure, put in more infrastructures in place
mhm,
so that the average African, average African woman can be able to go and actually have access to healthcare. And that's one of
mhm.
the things that we're trying to bridge that gap over here at the African Women's Health Project International, where I'm the founder.
Perfect. So Patricia Monte, the same question. Any like you have been doing this for a few years and you have experience in the healthcare system. So how do you see healthcare system in Africa in general?
So before I go into healthcare, it's very important to realize that a nation can only thrive when its population is healthy and stable. So if we do nothing in improving that part, the economical side of our continent might keep on being where it is. Now, having said that, when we look at healthcare, I mean, the foundation isn't fully there on the continent. We know that, and that's why we're still part of the developing countries. So we need to fix foundation. And when we talk about foundation, what are we talking about? We're talking about agriculture. We're talking about any that. If we can feed ourselves properly, if we can have proper shelter, healthcare will be broken. So now, having said that the basis isn't fully there, people have to then be understanding that our healthcare is still lacking behind, broken. But compared to what our princess said earlier, infrastructure isn't the only thing we need to look into. We got to look into healthcare policy. So government needs to do its part. We have to look into infrastructure, definitely, as you mentioned. We got to look into financing of healthcare. That is a big problem. But some people think it's the only problem. No, we have to look at infrastructure, but we need to look into the money as well. We got to look into education of our healthcare professionals. Healthcare professionals are also limited. So the ones that are there are limited, but they are not often on par with how much the healthcare is evolving. So those are some of the pillars. And one last part I didn't mention is the technology, the data, because we are only going to close the gap by making sure technology plays a critical role in serving our population. So for me, that's where we stand. Again, I say it's understandable that we're there, but we got to do something and put a roadmap to see progress. Even if it's going to take 20, 30 years, we got to start putting a roadmap to say every year we're going to try to do this. And that's currently missing, to be honest.
I definitely understand your point, and we will talk about the role of the technology and the finance in healthcare. You make a really interesting point, and I know that if you look at, according to the UN, Africa, the most of the country in Africa did not try to spend more money in the healthcare field. So we will talk about that later on. So, Princess Morajan, please, can you tell us more about your organization and how that has been impacting the African people.
Okay. Yes, and I'm so happy that Patricia did mention all the different steps that needs to be taken, because at African Women's Health Project International, and I have to actually take you a step further to let you know the reason why we started this,
Mhm,
because when you have lack,
mhm,
and you have the structure is not in place, the government is not as involved as it should be, especially with the citizens when it comes to their healthcare, and
mhm,
actually making sure that that everybody has access to healthcare.
mhm,
I remember when I came to the United States in the 80s,
mhm,
and I went back to Africa in when my grandmother died in 1997.
mhm,
When I went there, I saw a little boy that was so hungry. So when you're looking at that, you're looking at hunger, the
mhm,
hunger, poverty, hunger. Um, the little boy was so hungry that he was eating out of thrown food that we had thrown onto the sand, and he was
mhm,
eating it and putting some in his tattered clothing, right? So obviously the boy didn't have. The boy was hungry. He didn't, of course, he was 9 years old, but he obviously was not in school, which
mhm,
was a school day. So education is the second part of it. And then we now saw the boy now take some of the food that he had put in his tattered clothing
mhm,
and take it to where his mother was. And his
mhm,
mother was over there with six of with other children, all of them under 9 years old, the little boy being the oldest, right? And she
mhm,
was there in a makeshift uh, housing, so to speak, made out of cardboard.
mhm,
And she was sitting. She was sitting over there, and at that point, she was actually breastfeeding a little
mhm,
boy that was about a year old on her breast.
mhm,
She was breastfeeding that boy. You can see that not number one, because everything was clear to the eye to see. She had on a wrapper on her waist,
mhm,
so her breasts were bare, and she was breastfeeding the child out of one breast. The breast didn't even have any milk, so you can see that it was all shriveled, but the baby was still sucking out of it. So
yeah,
maternal health is the
mhm,
next thing that you
yes,
think of when you look at all that.
mhm,
Then out of her other breast, her other breast was a clear case of breast cancer.
mhm,
It was oozing. It
mhm,
was it had like lesions around it and everything, and it was oozing, and there was even flies going
mhm,
around it. So the
mhm,
woman's health,
yeah,
uh, and seeing this, especially after being in the United States. And at that time, when I first came to the United States, what I was really wanting to really think, really expose the American people to was my Africa, as I called it. And I did it
yes,
through fashion, through
yes,
designing clothing and educational talks, and letting
mhm,
them know that, their stories in America did not start just from slavery. It started way back from kings and queens and things like
mhm,
that. So
mhm,
cultural education was one thing that I was really promoting and pushing
mhm,
until that fateful day when I met that little boy.
mhm,
So now, what do we have here? So you have hunger and poverty, of
mhm,
course, right there in our face.
mhm,
Education for the little boy, for a
mhm,
child. So education,
mhm,
educate a child. You have maternal health.
mhm,
Yeah, and maternal health, which includes the nutrition, for the child, before and after, the child is born and things like that. So, and then you have the mother who was battling breast cancer, and the woman, she has six children and have never had a pap smear before. So you can just
mhm,
think about, all the different cancers, all cervical cancer and things like that. Those things come to mind. So we now wrap all of those different elements up together. And we now, we look at the UN Sustainable Development Goals.
mhm,
So you have Sustainable Development Goal 1. Two, one is poverty elimination, one is hunger, one is education, another one is women's health, equality, like different things. So at African Women's Health Project International, when I founded that organization, we now decided, okay, we're going to tackle 6 of the UN Sustainable Development Goals. So that we want to package it in such a way whereby we can be able to be effective when we're dealing with, when we're making our projections and and making plans as to what we want to see for Africa, what we think should be some of the fundamental things that needs to happen. And to cap it all off, we embrace Sustainable Development Goal number 17, which is collaborative partnership. So we're very, very big on that, because we know that it's going to take a collective effort of so many people together to be able to get this thing done. It cannot be a one-man show. And definitely at African Women's Health Project International, we're not a one-man show. Everything that we're doing is done systematically, and it's done with a strategic plan in mind, so that we can be able to have the Africa that we want to have. And we're driving that force from here in the US, but we have partners all around the world. So when I mentioned to you about having the Sustainable Development Goals and having that partnership, the partnership, this SDG 17. So because of that, like this, we now form alliances with different organizations, especially corporations, that we know that can be able to help us drive, the agenda that we're trying to see. And when I mention infrastructure, I know infrastructure is just the tip of it, because there's so many things that needs to happen, for the infrastructure to be in place. But we definitely, that is one thing that we're totally, it's a stark lack of infrastructure, and then there's the different supplies, medical supplies, equipments, and things like that. Things that the medical people need to be able to effectively carry out what they went to school to do. Because we have brilliant minds in Africa. When you're even looking at this COVID-19, and you see the people that are actually at the helms of really solving some of this huge problem that is plaguing the whole world, you see that most of them are coming from Africa, and Africa is really driving it. So the future is Africa. We've got to do some things, and we've got to put a plan in place. And I think, and I'm just really so happy that we're having this dialogue to be able to, because we need to really definitely talk with each other and know what each party is doing. What the doctor is doing in the Netherlands, and connecting back to the root in Cameroon is very great. It's really great. So we need to know what that is, so that we can be able to connect Cameroon to Nigeria, to Senegal, to to the different parts of the country.
That's really interesting point. We have to communicate. That's something really we have to do more, especially as African. So, Patricia, let's talk about your organization again. So, can you tell us more about your organization and how your organization have been impacting the African people, but especially Cameroon?
Yeah. So MedXCR Center is a company I started seven and a half years ago. Being actually active for 5 years, because we needed time to research. And what do we do? After years at corporate across Europe, I realized that technology was getting more and more in the healthcare sector, because we've seen technology impacting other areas. But 7 years ago, I realized that it was starting to touch healthcare. I had a sister that was very sick when we were kids, and I knew the gap we had locally, having lived in Cameroon. And just like the princess said, when you come into Europe or in America, you realize what the gap is, and then you start asking yourself, how can I bring that to my people? I think it's a question we probably all ask ourselves, and I also had that question. So when I did my master, I already started researching on how we could use technology in bringing that healthcare because personally I was touched by such an issue with my sister that was sick and that almost died back home. But it took me couples of years of having an own career and then realizing, okay, now is the time for me to do something because I feel like the market is ready. Because let's be honest, there is no way we can address the African healthcare issue, and even less the women African and kids African healthcare issues, if we don't have technology in between. Because even in Europe or in America, the resources are limited. They still need human resources in the healthcare sector in this part of the world. Think about it when it comes to our part of the world, because every time kids or students are educated there, they prefer to fly here because they will get better pay. So the lack of resources is even bigger. So when I saw that technology was touching the space, I said, this is the time, because now we can have proper talks by introducing technology in between. And that's basically what my company does. We develop a technology in addressing specifically the topic of universal health coverage, which is 3.8 in the SDG. So we really had a targeted focus, but I gotta be honest, the 3.8 is such a big issue to be addressed, because I mentioned earlier 5 key issues to be dealt with in healthcare, and 3.8 is making sure all of them communicate and collaborate for the sake of providing access to every single human being of each nation. Why not at the Pan-African level? Why not? That people, if there's not enough doctor in Cameroon, that they can dial a doctor in Nigeria without having to worry and being taken care of remotely. And if there's a need to fly, instead of flying to France or to the US, they fly to Nigeria. And then we're already going to create an business within the continent and create huge opportunities. So that's the space we're in. We're really into technology. We're really into universal health coverage, but it's a very nationwide, government-driven type of initiative.
Good. Princess, let's talk about again about some struggle in Africa. I know, like I said, you have been doing this for many years, and you have been to Africa, especially from Africa, and you live in the United States of America. You know how healthcare system work here. So, in your knowledge, why Africa still struggle to change the healthcare system?
Okay, in the healthcare system, like I mentioned at the opening, when you look at why they still struggle, is because we don't have the structure in place. We don't have we don't have enough infrastructure to be able to take care of the citizens, and that's why I mentioned, right off the bat, I mentioned infrastructure. We need to make sure that we build up our infrastructure system, and one thing, of course, when you build up the infrastructure system, that means the technology aspect of it, the making sure that the proper equipment are there for the physicians that are carrying out the work. The reason why we're failing and we're struggling, and is because the infrastructure is not there. And when the infrastructure is not there, that's the reason why you see the most elite, the ones that can afford to, when they get sick, they don't stay in the country, they fly out to Europe. And we need to change that mindset. So that's the reason why I've said that, once we have the infrastructure in place, whereby even if we start building up infrastructure and even manufacturing some of our natural products that we have, even if somebody gets sick in Nigeria and they can't get any help, but in Ghana, they have the infrastructure in place, they can actually fly there. Flying within Africa as opposed to flying outside, into the West world. So that's one of the things I believe. There's no ifs about it. Infrastructure definitely needs to be a big structure that needs to be put in place, a big strength that needs to be put in place for us to be able to meet up.
Good. Okay, Patricia, what about you? What do you think about that? So, in your knowledge, Patricia, why Africa still struggle, and why we always have to get out the continent to go get a medication, like I said before? You know, from Cameroon, you know exactly what I tried to say. In case if someone gets sick, even though you work in the government, you have enough money. Look what's happened to Ivory Coast right now. The prime minister is sick, but he has to travel to France to get medication or get treatment. So what do you think about that, Patricia, as someone who has been doing this for few years?
Yeah. So I think just like I mentioned earlier, we all know the Maslow hierarchy, and it
Mhm.
often says if you don't have the basic needs fixed, it's impossible to go for the next level. So for me, that's already one pillar of the issue. We're still fixing the very, very basic level for our population. It doesn't mean there are not few people that are wealthy,
Mhm.
that have nice cars, but we are not yet at the right level in terms of nationwide and
Mhm.
Pan-African wide. So that's for me one angle of the
Mhm.
issue. Second angle of the issue for me is we also beat ourselves quite a lot when it comes to healthcare. And I will take you a bit back in time when it comes to the healthcare chronology. It's already only around end of the 18s
Mhm.
that Europe came up with modern medicine.
Mhm.
So from the 0 years or before Jesus Christ years
Mhm.
till the 18th years, they were using traditional medicine.
Mhm.
What it tells us is that traditional medicine can do up till a certain level if it's
Mhm.
well organized, well structured. I'll take it even a step further with the traditional medicine. In the Chinese healthcare system, in
Mhm.
its whole structure,
Mhm.
you always go first through the traditional medicine
Mhm.
before moving into the modern medicine. And they're all sitting within the same hospital. I met someone from the government of China and he explained that to me.
Mhm.
And that should already tell us that in Africa we do have traditional medicine. We don't tap enough into that.
Mhm.
Why is that? I'll come back to the conclusion later.
Mhm.
So for me, we can do a lot with traditional medicine,
Mhm.
but I understand that your question is related to why aren't we making the step towards better modern medicine?
Mhm.
Isn't that the question?
Mhm.
So the reason why we are not yet moving properly to the modern medicine is what I mentioned earlier.
Mhm.
But second of all, I strongly believe that we lack trust.
Mhm.
When you talk to many people across the continent, they look
Mhm.
at modern medicine as the thing of white people.
Mhm.
Literally, we feel like it's nothing, but it says a lot in terms of even if you train the people,
Mhm.
they feel like it's someone else's way of doing things, of approaching the world.
Mhm.
And for that reason, we don't embrace it properly. We don't apply the rules the way it should be applied simply because we don't trust it.
Mhm.
And that means partly, or let's say overall, for me, leadership is the big problem.
Mhm.
Leadership is the reason why we don't organize traditional medicine properly. Leadership is the reason why no one is helping our population
Mhm.
to understand, trust, and give the space to modern medicine to come in there
Mhm.
and use it in the right way.
Mhm.
Now, the lack of trust, and I will explain why I talk about the lack of trust. The lack of trust is the reason why even the private sector, because we can beat our governments,
Mhm.
but the government, it's mainly the public sector they need to work on. If we look at it from a private sector point of view,
Mhm.
anyone could go there and buy the big instruments and the big machinery and, and ask for money from the population. But you know what tends to happen? The
Mhm.
population not fully trusting modern medicine yet,
Mhm.
they tend to go for traditional medicine that is not often very structured.
Mhm.
And say when they go to modern medicine and they hear from the price, they say, poof. And partly as well, modern medicine is extremely expensive because the leadership is not doing the right thing to level up the prices, control the things. So trust is a big issue.
Mhm.
Leadership is another big issue. And once both are addressed,
Mhm.
then I think we first will tap into our traditional medicine because it exists. We have plants, we have the know how. We need to better organize it. We need to track the effect of traditional herbs we give to people, and we'll make mistakes, but we need to put a roadmap. I come back to the roadmap thing because I can tell you, even today, Europe is still fixing its healthcare system. So it's never going to be oh, we've done it and we're already perfect in healthcare. No, it's a roadmap. We need to tell ourselves, okay, how many practitioners are there? How many can we track, trace? But at least we have a roadmap, even if it's going to take 100 years. But today it's not existing. We don't see any roadmap. We don't see any plan. We don't see any support. And for that reason, leadership for me is a big issue, and partly trust of the modern medicine is another issue.
Good. You really said something really interesting, especially about traditional medicine. As someone who's from Africa, I know how I grew up. When I grew up, I used to live with my grandma, and my grandma always used traditional medicine, and I know since that's how I grew up. And then I really, really thank God my grandma will use that, because I'm not going to say something, but I feel like I'm still not getting sick the way some people used to, because I think the traditional medicine has been affecting my body. I will definitely say that in the other hand. But
And you're so right
yes,
about that, especially when you're talking about traditional medicine. I wanted to add to what Patricia was
yeah.
just saying about how traditional medicine,
Okay, go ahead.
traditional way was the way we used to do. That's the way that was, something that we, it was working great for us. And of course, we did, when we're talking about the traditional medicine, the thing they're doing in Nigeria right now, they're putting some more structure to complementary medicine, to the traditional and complementary medicine now, so that in such a way, to be able to bring that trust, to the people. Because, like you said, when the West, the modern medicine that we see now, when it's over there, people trust that better than the traditional medicine. And then at some point, they made us actually think of traditional medicine as some kind of juju, or some kind of, black magic, some kind of things like that. But
Mhm.
now there's a big boost to the use of traditional medicine, complementary medicine, because just like you mentioned, even in the Chinese, even though they have the modern medicine, the traditional medicine is a big part of it. It's a big, they sit side by side. And what just happened in the last few days? You have the foremost African king, the Oni of Ife, Oba Adeye, Ogunwusi Adeye in Ile-Ife, actually just launched this product that they've been working on for a whole year when this COVID hit. So they started putting together the traditional and complementary medicine professionals that are actually, this is what they do day in, day out at the university, and they put them together. And yesterday, he just actually launched this COVID-19 herbal medicine that they have actually worked on. They've worked on it. They've tried it on thousands and thousands and thousands of people, and
Mhm.
as well as even get the NAFDAC approval for it.
Mhm.
So we when they went through all that steps, the necessary step that it needs to take to be able to be accepted, on the national level. So now they launched it yesterday, and that's one thing that I want to even look at, and I want to applaud what the king is actually doing, in making sure that the people, the medicine gets to the vulnerable populations, and to actually be a stakeholder and sit over there at the edge of the breakthrough, for the different medicines, the different ailments that's going around, in the world. And so this is a really great breakthrough for us. And I'm glad you mentioned that. So that is something that, I'm really excited in working and seeing some of the other medicines that they're able to actually produce, so that it can be able to help the populace.
Good.
I do want to add something for someone that is very much into modern medicine and believing into modern medicine. I think I keep on saying that I believe traditional medicine has a place, but I think the way it's applied on the continent at this stage is not well organized. So I don't want to, because the herb, as you're saying, in Cameroon, I've seen that popping. We've seen that in Madagascar as well, with the president um, um, advertising one product. But at the end, none of them showed effectiveness. And why isn't it effective? Because officially, every product that should be ingurgitated, so that should get into our body, needs clinical trials. And as long as we don't do the clinical trials the way it should be done, with proof that they work, it's difficult, to be on live TV like this and advocate to drink anything. I think it will be wrong for us. Now, you say the chief has gone through that in Nigeria. Trust you, I believe that's happened. But what I've seen in Cameroon, what I've seen in some other African countries so far, is they only rely on, we know our herbs and we know it works. But medicine doesn't work like that. And why is that? It's because it could work on the direct disease you have, but who studied the side effects? The side effects today, the side effects in the future. Who is tracking that? Because that's the whole complexity of healthcare. Which kind of body does it work on? Which kind of DNA doesn't it work on? Who has done studies on that? Who is tracking that it's working? And same with all the things we drink, often from our grandmothers. We never know what the side effects they create. And for me, that's a little part that leadership needs to put in place to start saying, okay, we are not starting big bang saying, okay, we are already perfect, but at least every time someone takes this type of herbs, that we keep seeing, is it healed? Is it healed completely? Do we hear anything, on the echoes? All the people that drank it, how is it behaving in the body? Are they perfect, or are we starting seeing their penis becoming smaller, bigger? We gotta track that. And as long as we don't get that next step, people will not fully trust. Yes, on the continent we might trust, but I keep on saying that on live TV, I want to be cautious, because it's about healthcare. And if we encourage people without telling them there's a little risk, tomorrow it might backfire on us as well. Okay. So the leadership got to do something there.
Okay, good.
Yeah, and
let's
that's
talk
why
about.
it is. Okay.
Okay, good. Just let's talk about women again, women healthcare, because that's one of the topic here. And if you look at, according to the UN, 6% of maternity death happening in Africa. If you look at it, 1 in 42 African women is still dying during childbirth. For example, Nigeria, 262,000 babies die at birth in Nigeria. So why the maternal mortality is high in Africa? So what exactly the reason, Princess?
With child mortality, with maternal mortality happening, well, you have to go back to the structure. The women, the treatments, the care that you get, especially during pregnancy, is very much important. That takes you from the time when you found out that you had, you're pregnant, until the child is born, is very much important. So it's just the structure. We need to, the structure needs to be in place over there. The reason why you have such rates that's so high compared to the Western world is because, a lot of things that we need to put in place. So we really need to go structurally through the nutrition, and making sure that we have the different the different tests that needs to be carried out on the mother and the health of the mother. The all of those are all stepping stone to that. So, and I think it's something that maybe Patricia will be able to answer more. Actually being in the field, in the medical field herself. But yeah, the structure, the nutrition, what goes into the body, especially after the baby is conceived, through, and the process that you go through pregnancy, and then during childbirth, are there proper equipments there? Are there do we have, do we have the different, because most of those births are actually something that's actually preventable. Those are some of the things that, especially in the Western world over there, they might have some other techniques or other equipment that's already in place over there, so that if a child goes into distress, they can be able to do something immediately and save the life of the child and of the mother.
Perfect. Mrs. Patricia, would you like to add something on that?
Yeah, the little one thing I will add, I will come back to the universal health coverage. We need universal health coverage on the continent. And why? Because next to what the princess highlighted, what I see on the continent is there's limited resources. And you know who are the beneficiary of the limited resources first? They are the men. They are the one with the money, because healthcare is paid out of pocket. They are the ones that if they go to a doctor, they will be taken care of first, because they are the men, and so that already puts women and kids out of the big equation. So if there's not enough doctor, in general, the men, because he's the one with the cash, if you don't pay, in general, no one takes care of you. So that puts many women out of the equation first. Then the next level is all we talked about, not enough hospital, people not enough educated, but we will only fix that with universal health coverage. Literally, that's my solution to that issue.
Patricia, let's talk about again education and healthcare in Africa. And we are talking about exactly about teenager, because exactly. So do you think that because of lack of education and healthcare, teenager mothers experience more death, and how?
Education is always an important thing, because I think since the beginning, when we talk education and healthcare, we tend to see only the physical side. There's a big part that is mental, and we shouldn't lose sight of that. And what the education does, it already plays a role mentally. I love something that you did when I talked about traditional medicine earlier. You said, "Oh, when my grandmother gave me, was giving me this, it probably keeps me still alive now." You know how we call that in healthcare? It's the mental part that, by knowing you might be healthy, you keep yourself in the right in the right mindset. And it's a mental side of the story that plays a role. So in healthcare, they tend to say 50% of healing in healthcare starts here. And the other 50% is either modern medicine, it's a doctor, and so forth. So if we don't play a role in education, showing the people that they gotta understand their body, master their body, they need to feed themselves better, they need a clean environment. Education plays a role so that people can already themselves do a big part in keeping themselves out of being sick.
Good.
Because by making sure that they're educated and they understand all these elements, we keep the ones that, let's now talk about God or the universe, the ones that God said you will be healthy. Now there's another group that we call the chronically ill people. So unfortunately, they were not born with perfect health, or along the way they caught something that is still with them. If we educate our youngsters and our mothers, because the mothers are the pillar of the house, to know how to care about the environment, so hygiene, to know how to care about feeding themselves, so that what they put in their body is good enough to keep them strong, and not getting some illness, just flying illness. What we will do is we will put less pressure on the limited resources we have on the healthcare on the continent. And what will then happen, it's only the chronically ill people that will then seek to get into the healthcare system. That is already limited. That is not good enough. We know it needs to improve. But by playing a strong role at the education level, we are already going to make it smaller, the group of people that need to seek care. And that's already going to play a big role.
Good. Princess, would you like to add something? Or okay, before you add something,
Yes.
so in your knowledge, Princess, why protecting the well-being of women and children healthcare is important?
Okay. And this is one. I wanted to make uh, one thing, especially in when we're talking about education.
Yes.
When we're talking about education, I want us to be cognizant of the fact that when we're talking about even trust, uh, trusting, the people, and trusting ourselves, trusting within ourselves. I think that's one of the things that's been basically shielded away for a long time, that we don't even trust even ourselves, and we don't even trust even if we have any kind of breakthrough until somebody in the West tells us that, okay, this works, before we actually believe that it works. Just like I even mentioned about the new anti COVID
Anti-COVID.
remedy, herbal remedy, that I just mentioned. And immediately it was like, oh, well, they've said something happened over in this country, something happened over in Madagascar and all that stuff. So automatically we shun it to the side. And we shouldn't do that. We need to definitely rearrange our mind so that we are able to receive what it is that the things that the brilliant minds that we have over there on the continent of Africa are doing, as opposed to waiting for the white man to actually tell us how, what is right, or what works and what does not. The reason why it took so long for that COVID thing to just be launched just yesterday was because they were having clinical trials for months. And you can see the numbers in Nigeria is not high. Like when you look at even in the Western world that we have over here, they're doing the same thing. They're doing testing, they're doing clinical trials and all that stuff. They're looking for ways to make to get medicine so that people can get well. They went through the same thing, and this number is still not down or whatever. But when you look at how, especially considering the the uh the uh or the adverse effect that it will have, especially if when COVID breaks inside like a country like Nigeria or Lagos, how closely dense the place is. So if COVID hits that place like this, everybody will be infected in 2 minutes, right? So what I'm saying is, and when you look at the numbers that's coming out from there, it's very, very low compared to the Western world. There's a reason why that is so. Is because there's been people that have had this COVID, and they've actually used the medicine on them, and it actually worked. So they did go through the proper trials. And so what I want us to just be mindful of, especially we that are in the Western world, we're in America, we're in Europe, we're in different parts of the world, is that when they say, oh, this is made in Cameroon, or if this is made in Nigeria, we just automatically think, oh, well, it's just like they say it was made in Madagascar. They're just promoting something. No, they are working. These are brilliant minds working very hard to actually make sure that they get the cure for the things that for medicine. So I need and that's part of education too. We have to retrain our mind so that we don't automatically shun down anything. I mean, things that the progress that's been made on the continent. So we need to definitely start trusting ourselves more, as opposed to just trusting the Western world. So that's my African mindset, and that's what because I still believe that my grandma's herbs, just like your grandma's herb that you use, that actually kept you to the. I know it's in the mind, both in the mind, but also too physically. You can feel it and you know it. So it cannot just be relegated to what I think it is, and that's the reason why it is so. So that's all. That's one of the things I just wanted to mention. And the king, for him to actually sign his name on this. This is the foremost African king. King Ogunwusi Ooni of Ife. This is the foremost African king. For him to actually come out and sign his name on this, so you should know that definitely this is very, important.
Good. Patricia, would you like to say something?
Yeah, I just wanted to add that she shouldn't get it wrong. I was trying to highlight that because you didn't mention clinical trials that he went through, that we gotta be careful again because we are broadcasted. There are people that will listen to us. We need to be careful in advocating. And I didn't mention that no one should validate what he did. No, I just highlighted that we're talking about things that need to be consumed and will be taken. So we gotta, and that's why I said leadership needs to play a role. Do our herbs, do they work? They definitely work. Are they capable of doing what modern medicine does? I personally don't believe that until we put in place system to track the effect of those herbs. Because so far, I've taken those herbs as well. I come from Cameroon. But what I've seen is you drink it, no one tells you, is it going to give you side effects or not? And we all know that it probably could, but no one is tracking that. And there we shoot ourselves in the foot. Is it wrong to try to say we got to take it to the next level? I don't think it's wrong. And that's what I'm trying to highlight. But if you say that it went through trials, then it's a good one. And what I've seen in Cameroon, I think we've had 2 or 3 of them, but we're still having cases. And Madagascar also had one, and they promoted it even globally. But they're still, yeah, wanting to protect themselves. So, and even the vaccine that came out, you hear that they're still questioning if it's really going to work, because medicine is a tough space. It's a very difficult space where we need to grow, all of us, especially when there are new diseases.
Okay. So that's a really interesting point you guys, you ladies have been making, and I definitely understand the traditional medicine, and I definitely understand the vaccine. For example, if you look at Russia, to Russia was talking about the vaccine. Even now, some countries in Africa or Europe did not want to take the Russian vaccine. It just depends about how the country is dealing, how this healthcare system is growing. But like you said, Princess, I definitely trust and believe the traditional medicine, especially as someone from Africa, and the European medicine too, that has been helping many people around the world. But we just have to work on all those. Healthcare system is something we have to improve more. If you look at here in United States, they have been keeping trying to improve more the vaccine. So we just have to improve more. So,
Mhm.
Princess, what are the role of the African government, and do you think they should put a new system in place to improve our healthcare system, especially women and children?
Yes, one of the things that the government that I do believe needs to put in place, because we do put everything, we do, if there's success in the country, we put it at the foot of the government. If there's lack, like we're talking about right now, it sits right there at the foot of the government. When you're
Yes.
looking at most African homes, the the homes, loving home, what have you, but we have electricity is something. There's no
Mm,
constant electricity.
mm,
The food itself is not a, nutrition is another thing.
mm,
Education, those are all the fundamentals. And Patricia mentioned this,
mm,
right off from the onset.
mm,
The government have to put all of this in. The education of a child is so important,
mm,
because these are the future. These are the ones that are going to carry on the reign.
mm,
But if you
mm,
don't educate them properly, or they don't even have the proper nutrition to be able to
mm,
even sit down and to be able to listen and actually assimilate, the things that you're teaching them, so you fail there. So you have the education part of it needs when you start from the home. From the home, okay, we need to have electricity, we need to have water,
mm,
and we need to have the environment needs to be clean and clear of
mm,
cluster. So the environment is a big part of it. Then
mm,
the child leaves from the home, goes to school. The school needs to have a proper structure. Some of these schools are like, some of them are even like makeshift. So they just, maybe they put some cement together, 4 walls, and then they put the child inside with a desk and a table and a blackboard. So and so in some places they don't even have that. So you have some places like this in some rural area whereby the children actually they bring a cement to sit on and want to write on. The supplies for the school's children, those are on the child while they're in school. What nutrition are they putting in their body? That needs to those are things that needs to be that needs to be taken care of by the government. By the government. She enjoys over there in Netherlands and the different parts of the world, and if she gets a cut, if you get a cut right now, you can just easily just carry yourself and go to the emergency room, and they will treat you whether you can pay for it or not. They will give you that immediate life-saving treatment, regardless of the ability to pay.
Good.
Those are some of the things that are so lacking in our world over there in Africa. And we have to make plans, and these are the things that the government is supposed to provide for its people. I'm not talking about what the people are supposed to provide for. These are some of the basic things that the government are supposed to provide for the people in it, and then the people now in turn, they be good citizens. They pay their taxes. They pay they buy their homes and things like that. They do charity work, do all of that. But the basic structure needs to be in place, and that's the reason why I keep on mentioning this infrastructure. Infrastructure is not just building the house, putting the four walls together and all that stuff. Infrastructure is so much in depth, and that's the reason why, like, I have a company that the Innovative Global, and that for years we were trying to bring together proposals and partners from US and some even from Brazil, from different places that want to do business with Africa, and we'll package the things together and bring them before the government. Okay, that these people can, so they can be able to give you solar power, or build solar power panels so that can be able to give lights to the people and things like that. We've done that for years, and most of the time when you package things together like that, and then you take the partners, all of you travel to Africa, and then you meet with the government. At the end of the day, even though the money is there for them to be able to carry it out, because when you're looking at it, we bring the solution. They have the money, we bring in the solution, and at the end of the day, like this, you just find a way whereby some people get paid at the top, and then before you know it, like this, the project is dead on arrival. Same thing with hospital, because that was one of the things I was very passionate about, and we got in partners that were ready to build and do this, and even finance. They have ways to be able to finance it and all that, and put all these structures in place. When we got over there, the people were busy. The top officials, not the government, but but wherever the representatives were that was meeting us initially, the first thing they were trying to do is to try to get some kickbacks from the people that are coming to come and help and to come and do things in the world. And so you have that trust in, whereby he tainted a lot of our efforts to be able to bring in infrastructure into the country, into the different countries over there. We did it in Ghana, we did it in Nigeria, in Uganda, in different places. And one of the things, especially with Nigeria, one of the things that actually happened was because of that, trying to get kickback. So because the people didn't want to do any kickback immediately, they were rejected. They rejected our offer, whereby we brought in the infrastructure and we brought in everything, and yet we were rejected. So those are some of the things that you look at, and it's like, okay, what do we need to do? How do we get this information to the government so that they can be able to do what it is that they need to do to make sure that the citizens are taken care of?
Good. Patricia, let's talk about leadership, because you have been talking about leadership since we started. And I believe that leadership is part of the things that will definitely go into Africa, especially in the healthcare system. So, in your knowledge, because you have been there for a long time. Like I said, what are the role of the African government, and do you think they should put a new system in place to improve our healthcare, especially women and children?
I think from the beginning I said that the universal health coverage is needed. Now, I do want to break the problematic of government a bit because we have a complex 1 billion people on the continent. Um, it's no backstory. When we talk modern medicine, we talk complex science. We talk complex technologies as well. I really want to split it because with traditional medicine, we talked about it already, and the continent can go that way if they want to. But leadership has to say, we don't trust modern medicine and we'll go to traditional medicine. What we're discussing now is for them to really take the modern medicine and bring it to the people. Now, like I said, modern medicine means complex science, complex technology. I want to take us back into the Trump era. Remember when Trump for 4 years was there with an educated population, literally, and that he was screaming, I don't trust science. He was screaming that. That educated population started not trusting science and therefore not trusting modern medicine anymore. We saw it in front of us. Why would you expect the continent, not to say that we don't have educated people on our continent, but we know the proportion isn't big enough yet to fully understand that complex science and complex technology that the medicine, the modern medicine words brings with it. So having said that, we can't expect and put any of the blame on the population. They are not capable of deciding, checking for themselves if it's good enough. If even a continent like America or in Europe could be put in doubt by its leaders saying, nah, we don't trust it anymore, and no one wanted to take the vaccine. It took a big campaign after the Trump era for citizens in the developed world to start saying, we want to do it. The UK had to get the Queen in front of the screen yesterday to bang again, you should trust it. And I can tell you the influence came from the US with Trump saying he doesn't trust science. Now, back to then your question, without leadership saying the right things, showing that they trust science, whether it's science from the continent or science from other parts of the world, it's not gonna land. That's on the trust level, and it takes them putting policies in place and putting the money into it for the infrastructure, like Princess is advocating, to also come into friction. So the whole thing lies in their hand. If it's failing, it's them. I want to address the last part of the story. When they are sick, as the ultimate authority, they run in this part of the world. Which signals are they giving to the local people? We don't trust our own healthcare system, so don't go there. Meaning, even if they would at least start treating themselves with the local doctors, it will already tell us or tell the population, okay, we can go there, we need to improve it, and maybe we need to give them time to improve it. No, they send a signal, it's crap. We are not doing anything because we can take a flight and go somewhere else to get access to it. So they leave us with either they don't trust it, so they don't trust the whole modern medicine, or they tell themselves, we don't care about our population, or at the end of the day, the decision lies with them and the problem lies on that side as well.
Good. Good. Patricia, let's talk about financing again because you have been mentioning about that. Like I said, the most of the African countries do not spend more money in the healthcare field. So, do you think Africa should invest more in the healthcare system? Patricia, that's for you, please.
Yeah, there's no doubt about that. More investment needs to come. And we need to look at healthcare financing at two levels. There is financing for the system to get better, and there's financing for the oil to get into the system and get the system to turn. So that's two separate money needed into healthcare on the continent. For the first money, when it comes to healthcare financing to improve the system, because of COVID did put too much spotlight on the whole continent for them to, it was screaming everywhere, you gotta do something. And if you look well, many officials as well couldn't really fly out. They had to stay there, their kids had to stay there. So many of them are saying, we gotta do something about the system. But that's only a piece of, I say a piece of the problem. The biggest piece is us having an insurance. And the insurance in Europe is the oil going through the system once the system is better. Just to give you some numbers, I cost the Dutch system every year 5,000 euro. That's what the Dutch system puts for every citizen in the Netherlands in case you get sick. I pay a piece of, so I have to add almost 1,200 or 1,500 myself. But if you look at the ratio, that means that the Netherlands or the Dutch system pays almost 60% of what I would cost if I would go into to get access to healthcare. And they need to pre-save such an amount of money for every citizen, because that's a part the insurance gets. And then we pay another part to get it complete. And when we get sick, sometimes there is extra you need to pay yourself, but there's already a big basics you can get access to. The biggest challenge of improving the healthcare system sits on this second piece of money.
Good.
That's where the big challenge is.
Good. Princess, would you like to add something on that?
No, I totally agree. And what she's actually, do you have the technology in place for that financing? Because if you have that, then that's something that's actually would be great to be able to introduce, to the government. And it's something that we can actually work together on. I think that would be really phenomenal. I really like that because, it's the same too over here in the United States. In the United States, especially, they have this Obamacare, which literally, you are covered no matter what, you are covered, for treatment. And you pay a certain amount, and then the government actually pays the biggest portion of it. But it's something that, if an emergency happens right now, you can actually go to the emergency room or go to a healthcare clinic and actually be treated without actually worried about it, and not worried about getting a huge bill back in return. So it is something definitely we've advocated for that actually in Nigeria. We did that in 2006 because my younger brother is a physician. And one of the things that we, and he's on the board of the African Women's Health Project International. And we actually put together a proposal. We call it the Community Healthcare Plan for Lagos State that time, because one of our cousins was actually running for the governor of Lagos State. So we were going to actually put that as part of his proposal, for the government, especially once it gets in place. And of course, we presented that, and it never did go much further, than what we think. But I think with now, now we're in such an age right now, especially post-COVID, after this COVID has rampant, that the government are actually listening. They're wanting to actually hear from people like Patricia, people like us, to actually come, people like my brother, Dr. Babajide Ogunlana, to actually come and actually, put together some proposals, that things that work over here that might be able to work well over there. And because the financing is already, those structures are already in place, it is easy to be able to input it. One thing I do believe is that in Africa, we definitely have to start thinking about doing things, when we call the African marketplace. The African marketplace usually consists of, they have the local marketplace, which is like maybe like within Nigeria. Then you have the regional marketplace, which they just open up, which is like trade between Nigeria and Ghana, trade between Nigeria and Sierra Leone, different places, all across. Then the international market, which is, a trade between Africa and the rest of the world. So now with that opening up like that, with that opening up, and we believe that, for a long time like this, we have a lot of different African huge corporations actually in Africa that actually haven't tapped into the international market. And until they actually tap into that international market, a lot of these things will not be. Because when you even look at insurance, for instance, the insurance system, for them to be able to, because, when you're looking at, even to having the healthcare system put in place, the insurance, some of this burden does not necessarily have to be paid by the government itself. But, if they are in the international marketplace, whereby they can be able to have the likes of Blue Cross Blue Shield or something like that, that might be able to look at what they have in place and be able to finance, even the citizens right over there. Then we need to definitely look in that directions.
Good. Patricia, I know that we have been talking a lot of points, but let's talk about the doctors or the physician. And we know that the most of the time, the most of the physicians we have in Africa, some of them have been traveling outside the continent to get education and then go back to Africa. And some of them never been to some countries like here or Europe. So do you think the government should put a system that will help most the African people, especially the people who study medicine, to improve more, so we don't need to travel to go outside the continent to get medication? Patricia.
You meant medication or education? You meant education, I guess.
Yes, like education connected to medication. So, but education, like doctors, physician, they definitely have to get education before they start working. But the most of the time, like I said, if you get sick in Africa, they have to travel outside the continent to get treatment. But if we have a system put in place to have good education, to educate those people who studying in the healthcare field, like medicine, or I know that they're going to help Africa improve more in the healthcare field. So what do you think about that?
Now, so funny enough, on the education part, I don't agree with you. We do have good education universities in the healthcare space on the continent. There, I have no doubt. Now, the beauty of healthcare is that it's a very fixed science. So books created, if you follow the path, you really know what you do. And the reason why I also believe we have good education system in terms of healthcare on the continent, it's because our type of diseases are not mastered by the part we believe are the best. So it's different competencies needed. You see, the way to treat malaria, many of the doctors here don't know how to do that. The moment you get AIDS, I think AIDS was a pandemic as well in the past, but I'm sure when a lot of people having AIDS here, when it moved to Africa, it somehow mutated probably. So the way of treating it, dealing with the patient also is different. So from the quality of our education, personally, I don't doubt the quality of our education. What I feel is missing is we don't get enough kids going to medical schools. So, and the few ones even going there, half of it go out. That's brain drain. They don't always come here because they want better education. They sometimes come to improve, so to learn new stuff that are not taught in our school, because viruses mutate over time and they become resistant to antibiotics. So they come for extra education. So the brain drain is not due to the fact that they come to educate themselves. The brain drain comes from the fact that they feel there's still space to make more money here. It also comes because they get too much pressure back home. The numbers of the WHO says 2.3, if I'm not mistaken, 2.3 doctors are needed for 1,000 people. So the way you have to look at it is when you go to Lagos, in a certain neighborhood, if there are 10,000 people living there, the government needs to ensure that if there is one hospital or one center, a medical center there, that the center has around 20 20.23 medical doctor somehow available for that 10,000 people in that neighborhood. That's also why you see in Europe, in general, in every neighborhood, you have and a hospital. Let's say not the hospital, but the family doctor. Yeah, that's how it's called in the Netherlands. You always have one family doctor or two or 10 in a certain neighborhood with a pharmacy, because those are your two basic things you need to have in place in a certain surrounding with a number of people. And there on the continent, we are in a rough of 1 for 10,000. So the gap is huge. Now, when you take it from one country to the other, we did such a statistic. I do have the numbers. If you need them, I can send them to you later if you want to add it as part of the statistic. And you will see from one country to the other, the difference is big. What we need to improve is much more encouraging people, so motivating a lot of youngsters to go to medical schools, even if it's back home, and find a way to tell the diaspora to come back. Because the brain drain, again, it's not per se because they come to look for better education per se here. It's simply because they are offered better packages. And I can tell you something because I've talked to doctors from the diaspora sitting on this side of the world. When they get to a certain level, there's glass ceiling here. So many of them after some years, if they were offered interesting packages to go and take care of people on the continent, many of them will move back. Many of them, but no one really puts in place a system to welcome them, to support them when they want to do the return path.
That's definitely a good point, Princess. Would you like to add something, especially
Yes.
even in America? Yeah, if you look at the healthcare system, Nigerian, they are one of the best doctors in the United States of America. So,
Yes,
just
and
can you tell us more about that?
yes, I would like to even add to agree with Patricia the fact that we have brilliant education over there, and that is even the reason why most of the ones that come over here, they actually excel, and they excel way above the their counterpart. Now, what the lack that we have over there, especially when we talk about medical school, is that you have the book knowledge being taught. You have a lot of it being book knowledge being taught, but without the necessary equipment for the doctors to actually actual practice on patients, to be able to have the necessary equipment. Some of them, because I have quite a lot of friends that are in the medical field that actually went to university, medical school in Nigeria, graduated top of the class. They're brilliant. When they came over here, some of them like this, until they actually came to do residency or what have you, that's the first time they actually like treating, like come in contact with the cadaver or do, or some equipment they see like this. They're like, oh, so this is what I've been reading about. They know it because that is one thing about the African mind. The mind is so vast and so brilliant. So with education, no doubt, we have superior education, hands down. But what needs to happen over there on the continent, what we need to do, the reason why we have, people, when they come over here, they do come and get experience or whatever. But, but what we need to do in the meantime, while they're going through this education, especially when they're in the medical school, there needs to be enough infrastructure, enough equipments and things that they can actually be able to practice on. They'll be able to do their clinicals, do a lot of the things, because I believe, especially with the kind of mind that they have, if we have the proper equipment, the supplies that they need, the infrastructure that they need in place over there, and they are able to actually carry it out, before you know it like this, you will have people even in the Western world coming to Africa to get treatment. And then when you look at, okay, say for instance, now we don't have the treatment, but they come over here and they are paid, of course, doctors over here make a lot of money. In Nigeria, I can't say the same thing for the counterpart, even though they're just as brilliant and they are, their education, they all got the same education from Nigeria over there. But the payment that the government pay them is very minimal compared to. And that's the reason why most of the time when they come over here, because number one, they didn't have the proper equipment to be able to practice out. So most of the things they have is the book knowledge. So when they get over here and they apply that book knowledge to the equipment and the infrastructure that's in place over here, their brilliance emerge and they just blow up. And so they're making a lot of money. And so then you get very comfortable. And then you look at, okay, if I go back to Nigeria now, there's no constant electricity. The roads are not there. The roads you go in Porto, by the time you travel 2 miles like this, you will have a headache just from going into the potholes and coming out. The water is not constant. You literally have to buy water every single day, or you have to have no filtration system in place, a national filtration system that you can say, okay, let me just even run water from the tap and cook food without having to get bottled water to do so. So, you have a lot of different challenges there. Those are some of the things that's happening. And that's the reason why we cannot, not look at, the infrastructure, the whole system, making sure that we have all the structure. If we have the structure in place, trust me, like my brother, all of us over here, people are here, they get comfortable because, the comfort is here. And so when we start providing, when the government over there start providing the comfort for its people, you see people coming back in throngs, and people really naturally want to be at home. Most Nigerians that are and I'm pretty sure it's the same too for Cameroonian, for all the Africans anyway, they would rather actually be at home because then the impact, the effect, the things they are doing, they are able to do it for their people, and they are able to do it for people that they're just normal. I mean, that is one of the things that's at our hearts, at the base. So
Thank you.
we just have to just work on that infrastructure, making sure that we get the government on board to making sure that they put a structure in place for us.
Good, thank you. We are about to end this interview. Patricia, would you like to add something before we end this interview?
Well, I mean, from all we've heard, it comes back to one thing: leadership needs to be improved on the continent. It's I don't know if through such a video we can talk to our leaders. There is money to be made when things are fixed. Way more money than when it's not fixed. So if we work together to put the basics, everybody will win from it. The population, and even then, because again, even in Europe, the top is corrupt. But because they've put the right things in place for the 80% of the population, they let them do. And that's the mindset we need to get our leaders to get into. Keep it, it's going to be difficult for 10 years so that we fix the basics. 80% of the population can kind of live properly. And then even if they want to stay 50 years in power, I don't see someone that will complain about that. I really see. That's all. Leadership needs to improve. I have a company, she has a company, so we are very willing to go and bring our know-how locally, whether it's in technology or in how to and actually fix the things. But they gotta work with us, because starting from the grassroots, personally, I believe in healthcare, it's a no-go. The impact you will have will be on a neighborhood level. And I think it's not big enough. That's something a company like mine, if we feel the impact is not going to be at least at the nation level or at the Lagos level, so a city like Lagos type of level, we don't want to take such a project, because so much has to be done, and they gotta really take serious when someone decides to come on the continent
Good.
and want to make a
Princess, would you
difference.
like to add something before we end this interview?
I mean, she nailed it right on point right there. So is what is needed. What is needed? We need to get the government, the leaders. We need to get the right leaders in place, and you have a forward-thinking type of leader, so that they can be able to put some of these structures in place. When these structures are in place, the people smile, and when the people smile, the country flourish. And people don't really realize that that the health, especially of women, of the most vulnerable, the women and the children, their health, actually is proportional to actually how enriched the country will be, or the continent will be. And so most of the time, like this, they relegate the health of the woman and the health of the child. They relegate it to the side, and which is like that is the worst things they can possibly do, because there needs to be a spotlight on that to be able to bring it forward. And then when you will see that, because the women are the driving economic force for the continent, period.
Thank you so much, ladies, for joining me this weekend on African Podcast TV.
Yeah.
Thank you.
Thank you.
Thank you. It's been wonderful.
Thank you.